Hey everyone, welcome back to this week's case. My name is Dr. Iyer, I'm with Residency Medical, and we have another high-yield case for you to help you with your diagnostic and test-taking skills. Let's get started. This time, we have a 26-year-old male who's coming in for flank pain that radiates down to his groin. This actually happens to him every few years, but this is the first time he's seeking care because it's happening too frequently. He has no medical history besides this and takes no medications, and the only pertinent vital signs are that he is tachycardic. Urine microscopy is done and shows the finding that you see in the picture. Based on this history and this crystal seen in the picture, what do you think the diagnosis is? A. Struvite stones. B. Uric acid stones. C. Calcium phosphate stones. Or D. Cysteine stones. Comment your diagnosis or the letter below, like and follow, and come back next time for the answer. Did you get the diagnosis right? The answer was cysteine stones. Cysteine stones are due to a proximal tubular reabsorption defect, where the proximal tubule of the kidney can't reabsorb cysteine very effectively. And as a result, cysteine accumulates in high concentrations in the urine, and in an acidic urine, cysteine actually precipitates out, forming really packed stones. These stones can be very serious and repetitive because this is a genetic condition where you have a constant failure of cysteine reabsorption. So these cysteine stones can be going on for long periods of time, leading to chronic infections and even renal failure. The way you diagnose these cysteine stones is by looking for these hexagonal crystals that are seen in the microscopy, as you saw in the picture last time. The way to treat this condition is to give a lot of IV fluids to dilute the cysteine, also to alkalinize the urine, because remember, it precipitates in an acidic environment, so if you give an alkaline environment, it won't precipitate as easily. And lastly, is to limit the amount of sodium you intake, because the more sodium you intake, the more dehydrated and concentrated the urine is, which makes it more likely to precipitate. Hope you learned a lot from this case. See you next time for more.